Here at TruMotion Therapy, we're a sports medicine chiropractic clinic. What that means is we treat neuromusculoskeletal conditions without the use of drugs, surgery, or risky procedures. We use techniques like dry needling, laser therapy, soft tissue work, corrective exercise, and adjustments to help people get out of pain and move better. And it's that last technique, adjustments, that we're going to be talking about today. Oftentimes when someone thinks of a chiropractor, that's the first thing they think about. And it is a very common thing that chiropractors do. They adjust the spine and other joints of the body. Today we're going to be talking about what an adjustment does, who an adjustment can benefit, and then I'm going to show you what a typical adjustment looks like. Typically when we think of an adjustment, we think of it being applied to the spine. Now we can apply adjustment to just about any part of the body or any joint of the body, including the ankles, the wrists, and the shoulders. What an adjustment does is it provides movement to the joint. We take a joint that's not moving as well as it should, we provide a gentle thrust to that joint, and we increase its movement quality. Not only are we increasing the movement quality and movement of a joint, we're also increasing the neurologic awareness of that joint. Now, it sounds fancy, but it's actually pretty simple. There's a lot of little nerves that surround the joints in the body, especially those in the spine. And when we adjust those joints to provide movement into them, we stimulate those nerves. That nerve stimulation sends a signal to the brain, which increases the awareness around the joint and actually decreases pain as well. So we have a pain analgesic effect. So we have three main things happening when we adjust a joint in the body. We increase joint motion, we decrease pain, and we improve joint or movement awareness. Adjustments have been found to be beneficial for a lot of neuromusculoskeletal conditions, including back pain, neck pain, headaches. We'll also do it for extremity issues like plantar fasciitis, adjust the joints of the feet, adjust the joints of the hip just above the foot to improve that joint movement and decrease pain. Now, adjustments are a very safe procedure, but there are times that we won't want to apply an adjustment. Times when there are severe neurologic compromise. If there is potential for a fracture in the area, we wouldn't want to adjust to that area of the body. And we also would not want to adjust someone who is hypermobile or actually has too much mobility. Those issues can typically be screened out in the history and evaluation process. So we've got Jake here and we're going to give him an adjustment. One thing that you're not going to see in this video is the thorough history and evaluation process that we do before applying an adjustment to any of our patients. So we're going to do a quick screen to see where he needs to be adjusted, but on anyone that comes into our office, you're going to get a detailed history and a detailed evaluation before we do any kind of treatment. So I have Jake sitting here on the table, simply going to palpate or feel the motion in the joints. Feel if there's anywhere that feels stuck and is not moving as well as it should. We're going to start in the lower back, work our way up the spine, and then into the neck as well. And as I said in the video earlier, we can also palpate or evaluate the extremities as well. We're going to stick to the spine in this video, but we can check the joint motion of all the extremities. So we found some decreased motion in the lower portion of Jake's spine, so we're going to get that adjusted, get that area moving better. So I'm going to have you lay on your side facing me. We're just going to set him up into a position that allows us to adjust those joints as best as we possibly can. This arm forward. Very good. Good. All right, got a little bit of movement into the lower back there. I'm going to have you turn and face the other way. Good. We're now going to adjust the upper portion of Jake's spine. So I have him laying on his back here. I'm going to have you cross your arms up just like this, grab your shoulders. Good. Take a breath in and let it out. Good. Lastly, we're going to adjust his neck. So I've got him in a seated position here. I'm going to have you slouch forward, kind of slide down in that chair. We're just going to feel which side of the neck is not moving as well as it should. Both sides are moving pretty well, but maybe a little bit stickier on this right side here. Now, some people may not want or may not be good candidates for traditional adjustments. These people might have osteoporosis, osteopenia, or simply a fear of being adjusted. They've never been adjusted before, and that's totally understandable. Well, we have tools and methods to still provide movement and pain relief for these people. We have instrument-assisted techniques, little instruments that help us provide a gentle impulse into the joints with much less force than we would on a traditional adjustment. We could use some gentle mobilization with our hands where we're not pushing quite as hard as we would on a traditional adjustment. Some of our chiropractic tables here in the office actually help us provide a gentle mobilization into the joints if we don't want to do a traditional adjustment. These are all methods that we can go over with our patients if they don't want that typical treatment. Now, that is a very abbreviated version of what a treatment may look like here at TruMotion Therapy. If you have any pain or limitation in your daily activities, we'd be happy to help you out. Please visit us at TruMotionTherapy.com to learn more and to schedule an appointment.